At this time, as we also are dealing with the COVID-19 scenario in our state, we're glad to have Dr. Dobbs back with us today. Dr. Dobbs, the floor is yours.
Thank you, Governor. I appreciate it. So, as the Governor mentioned, we are going into a peak phase for our COVID impact. That's going to be the number of cases, but also, too, the number of people who have to be hospitalized or need critical resources, intensive care, ventilator, and all that sort of thing. Right now, we have reported 161 new cases today with 2 additional deaths. Less deaths than before, but I wouldn't find that as too much encouragement because we know these things do vary quite a bit. We recorded a total of 2,942 cases with 98 deaths. As far as testing is concerned, as of last week in Mississippi, we had tested a total of 30,984 individuals, both through the private and the public health labs. We'll try to keep this information updated as much as we can. There are so many private labs, it's a lot of effort trying to validate all these numbers, and that's why a daily count's not quite so easy to come by. So we'll continue to make sure that we provide that information for you. As we look into going into this peak of medical need, we have been monitoring the number of COVID patients in hospitals and what the different capacity needs are. As of today, as of April 12th, not today, we had 124 COVID patients in intensive care units. We had 206 additional ICU beds available as of yesterday. We had 84 COVID-infected patients on ventilators, and we had additional 496 ventilators available. So going into what we hope is going to be the peak of need, we do feel like we have adequate resources. One of the key issues is going to be distribution of resources, and that's one of the things the system of care is going to be so important to make sure we get the patient to where they can get the proper care that they need. And the other thing I think, just want to make sure that you guys are aware, we are monitoring this health disparity issue in the Black community very closely, and we are finding additional statistics. You'll see additional information. But if we look at the case rate compared for Black folks versus white folks, it's 133 cases per 100,000 in the African American community and 55.8 in Caucasian. So expect to see more work in that. We've got a lot to do in this area. Thank you.
Thank you, Dr. Dobbs. You have heard us talk for the last 2 weeks about our healthcare system and our goal. We have implemented our plan to minimize the stress on our healthcare system. We have implemented our contingency plan, and we have in place a contingency to the contingency plan. Obviously, that's critically important as we move into our peak time. We feel very good about having adequate resources available so that we don't overwhelm our healthcare system. But in the event that things are worse over the next 4 or 5 days than we originally anticipated, we do have plans in place such that our system of care is not crippled. And so with those opening remarks and opening comments, I'll be happy to answer any questions. Start with Courtney Ann.
The North Mississippi side, I know that's part of the contingency to the contingency, but had not heard if a site had been secured yet.
What I will tell you is I think that we are very, very close to having a site secured, and I'll let Director Michelle address it. We do not believe that the contingency to the contingency plan is going to be necessary, but I think that we have identified the site. And Director Michelle?
Yes, Governor, I actually had a brief meeting on the way out, come over here with the member of the strategic planning group. They've been looking at a campus, and there been discussions with the president of Itawamba Community College up there about a dorm facility as well as an open type bay type facility that would follow a medical needs type sheltering. And Dr. Dobbs, I'll let you come back into that as well. It wasn't an option that we'd looked at before, but given more analysis of the way that COVID treatments are done, and given that this was not going to be a COVID patients per se, it was going to be a step down care, looking for a facility up there that would be close to Tupelo Hospital. So a location at Itawamba Community College or somewhere close is what's being looked at right now. The Camp Shelby model was complete this past weekend, so it would be available for use given the physicians and patients that would come in there should it be needed. But the location is at Itawamba Community College is what we're looking at.
And just as a reminder to everyone in Mississippi, One of the reasons that we think it is significantly less likely today than it was, say, 2 weeks ago, that we would actually have to utilize these contingency to the contingency plans is because of the early efforts of the health department, and then finally followed up with the executive order that I signed on Friday. The lack of elective surgeries, for instance, and also the mere fact that people are sheltering in place has led to a significant number of individuals that would have otherwise been hospitaled under normal times, not in the hospital today. And so when you talk to hospital administrators, particularly of the large systems, they have an awful lot of open beds within the system. So Dr. Dobbs, you want to talk to that?
Yeah, and that's the whole point of it. For well over a month, we've been talking about this elective surgery thing, and it's cumulative. A lot of, not that elective surgery and elective procedures are not important, but if they can be delayed such that we can have this excess capacity, it puts us in a lot stronger position whenever a surge occurs.